Catherine Walks is a project inspired by Catherine, a woman who loved costume jewelry, playing the piano, being a grandma, and meeting new people. She was also one of thousands of Canadians who have or will develop dementia. As Canada's population ages, the social isolation and exclusion of seniors is a significant problem. One study found that social isolation has health impacts equivalent to smoking 15 cigarettes per day. Research has identified that serious risk factors for social isolation and social exclusion are being a caregiver and having dementia. With 76,000 Canadians diagnosed every year, this problem will only grow. So what can we do? My proposed social innovation is a web-based app called Catherine Walks. Catherine Walks would be created by a team made up of researchers, web developers, and people living with dementia and their caregivers. We would work together to determine criteria of what makes a walk dementia-friendly and develop an initial set around Toronto. Users would then be able to add their feedback to existing walks through photos and notes, as well as map their own walks and share with other users. What makes Catherine Walks innovative? First, it challenges the idea that people with dementia are purely receivers of care. By using Catherine Walks, they are taking charge of their own well-being by identifying what works for them, be it walking to a beautiful tree or avoiding paths with stairs. And they are contributing to the well-being of others by sharing their knowledge with anyone from people with dementia who try out their walk or neighbors they encounter on their journey. It also challenges the established norm that people with dementia must minimize risk by encouraging them to go outside, to walk and wander, to expand their world instead of shrink it. How can we make Catherine Walks a reality? For funding, potential sources could be foundations such as the Mars Foundation or the Alzheimer's Society's research grants. The app could also have a donation function. In addition, donors, businesses, and organizations could sponsor particular routes. Catherine Walks would partner with organizations such as Public Health, the Police Service, public libraries, dementia advocacy organizations, and socially conscious programmers and developers. Through these partnerships, we would ensure users know how to use the app, would make it possible to integrate safety measures such as offering users the opportunity to register with the Medic Alert program, target businesses and organizations for dementia-friendly training and certification, and maintain and sustain the app over time. We hope that Catherine Walks will result in increased social integration and participation of people with dementia and their caregivers, better physical and mental health outcomes, increased awareness of what it means to be dementia-friendly in the general public, and a sense of social responsibility in activating that awareness in daily encounters. To measure these outcomes, we can use the number of users, but also how the app is being used. Are people trying out different routes? Are they walking for longer? We could also survey businesses and organizations that appear on the app to assess changes in perception with regard to dementia. Catherine Walks. Inclusion, one step at a time.